Today we're going to explore the Herbal database on how it can help someone who's having seizures. Now this is the opening screen when you first log in, and if you look here you'll see the menus. Another place to find the menus is to go up to the pin and click on it, and you see the menus right there. So let's start with the menus. Now we know that seizures are a neurological disorder. So let's go down to Diseases and Disorders menu. Then let's go down to Neurological Disorders menu. Click on that. And here they're going to be listed alphabetically. So let's scroll down. There's diagnostics, and here they all are. Let's go down to S for seizures. Here we go. And click on seizures. Looking at the left-hand side of the screen, we see an example of how the database is designed to help us visualize how everything is connected in holistic medicine. Here is seizures, but you see there are several other connections. We'll just take a quick look at those. First of all, it's a type of channelopathy. And what does that mean? Channelopathy refers to a group of disorders that arise from abnormalities in ion channels, which are integral to proper functioning of cells. And those are used for cellular communication. So if you break down communication between cells, all kinds of things can go wrong. And looking down underneath channelopathy, these are all conditions that involve ion channels. So let's go back to seizures. Now, seizures basically is the same thing as convulsions, and so I suggest you look at both of these. There's some slightly different information there. Epilepsy is one form of seizures. There are types of seizures that are not epilepsy. Functional neurological symptom disorder. Those are non-epileptic seizures brought on by stress, different types of psychological states. And there can even be gluten-induced neuropathy that can lead to seizures. So look over on your right, and that's the info panel. There's a little bit about non-epileptic seizures, and if you look at the top, there's some links to other areas for you to look at. A seizure is electrical misbehavior in the brain. I'm just going to scroll through this. Again, I'm just showing you where to go to find information that's going to help you if you have seizures or if you're helping someone else with seizures. How to handle a seizure, seizures in epilepsy, what causes them, seizure emergencies, and then these are also links to additional videos. Now we get down to this general definition. So we know there's sudden, uncontrolled electrical disturbances in the brain, and they can cause changes in behavior, movements, feelings, and levels of consciousness. They're a symptom of a brain problem, and they can affect people of all ages. There are different types of seizures. This is just a broad categorization into two main types, focal seizures and generalized. So focal are just partial seizures. They originate in just one specific area of the brain. They're divided into focal awareness seizures, and in those, the person is still conscious and aware of their surroundings. Focal impaired awareness seizures, obviously, there's a change or loss of consciousness. Then we have generalized seizures, and those involve both sides of the brain from the onset, and there's several types of those. Absent seizures, these are more common in children where there's just a sudden lapse in attention. They might stare blankly into space for a few seconds. Then the tonic-clonic seizures, those are really bad ones, also previously known as grand mal seizures. So muscles stiffen, that's the tonic phase. There can be rhythmic jerking, that's the clonic phase. They can last several minutes and may cause loss of consciousness. Atonic seizures are those drop attacks, sudden loss of muscle tone leading to falls or head nods. Myoclonic, those involve brief, shock-like jerks of a muscle or group of muscles. And tonic seizures, sudden muscle stiffness, often affecting the back, arms, and legs. As far as their causes, there can be a number of causes. For example, genetic factors. Some types of epilepsy are hereditary. Brain injuries. Trauma to the brain from accidents or surgery can lead to seizures. Infections, like meningitis or encephalitis, can cause them. A stroke can cause seizures through damaging brain tissue. Some developmental disorders, such as autism and neurofibromatosis, are associated with them. And then metabolic imbalances, for example, low blood sugar, electrolyte imbalances, or kidney failure. How do we diagnose them? Here's a brief explanation of diagnosis here. And let's look quickly at treatment and management. And these are the conventional treatments: dietary therapy. The ketogenic diet is the one that's best known, but more recently we've learned that the Mediterranean diet is even more effective, and we'll take a look at that later. All right, before we continue with this section, let's take a look at diagnostics. On the left-hand side of the screen, this is the color for diagnostics. When it comes to diagnosing seizures, we see that they can be detected through sound, and also there's something called a brain stethoscope that listens for silent seizures. Here are a couple of videos. Here's the brain stethoscope. We've already talked about what seizures are and a little bit about the types, so let's skip down to initial assessment. Here you're going to begin with a comprehensive medical history and physical exam. The key components are listed below. Then there are specific diagnostic tests like the electroencephalogram, imaging studies, blood tests. So if you want to find out about seizures, make sure these tests are getting done, okay? Differential diagnosis is really important. Here's an example of a case where there's a woman in her 20s who gives childbirth, and shortly after, she starts having seizures for the first time. What could cause that? Here are various conditions that could cause seizures after childbirth. Then we've got a section on what to do immediately. But what if the seizures continue for years after? That changes the picture. A number of things are going to be ruled out if those seizures continue. And these are the conditions that would be ruled out. For example, postpartum eclampsia. That can cause seizures for a while, but they don't last. If they continue, the most likely explanation is going to be new onset chronic epilepsy. And here is a little bit about that. All right, so let's go back to seizures. And next we can look at this healing therapy. That's the color for healing therapies. There's something called responsive neurostimulation for a variety of types of seizures. We've got a couple of supplements that help them. We'll dig into this in just a minute, but PEA and SAMe. This covers seizure first aid. Twitching is actually considered a seizure. There's something called Todd's paresis. And what that is, after a seizure, if there is paralysis, that's categorized as Todd's paresis. Let's go to types of seizures. Some videos. Spotting undiagnosed seizures, that's a big one. All right, so we spoke briefly about the focal awareness seizures, focal impaired awareness seizures, generalized seizures. We've already touched on these. But there are other types. Febrile seizures, that's when you have a high fever. Reflex and non-epileptic seizures. Now, if we look again on the left, all of these are different types of seizures. Let's pull up status epilepticus. This is a continuous seizure that lasts longer than 5 minutes. It's life-threatening, can damage the brain and rest of the body if not addressed immediately. Some videos explaining it here. It can happen in sleep. It's a critical neurological condition requiring immediate medical attention, characterized by prolonged or repeated seizures that last more than 5 minutes, without the individual regaining consciousness between episodes. It can lead to significant morbidity and mortality. There are some different types. One is the convulsive status epilepticus. Another one is non-convulsive. Here are the causes and risk factors. For example, pre-existing epilepsy, acute brain injuries, again, metabolic disturbances, electrolyte imbalances, hypoglycemia, hepatic failure. Withdrawal from anti-epileptic drugs or alcohol can trigger them. So can toxicity from overdosing on certain medications or exposure to toxins. Here's your clinical presentation of both types, the diagnosis and treatment, initial management. Refractory status epilepticus is when there are repeat incidents of this, despite initial treatment, prognosis and complications. And then we've got studies here. And we see there are some natural agents that help to control this. If you look over on the left again, they're attached. Astaxanthin, CBD, glyceric acid, rosmarinic acid, sulforaphane. And if you click on one of these, this is the color for phytochemicals. You can learn all about it and how to use it and where to find it. It's in a lot of cruciferous vegetables. All right, now we want to go back to seizures, and one way to do that is to click on the search bar to get a history of where you've been, and I'm going to go back now here, and we are going to go over to Herbal anticonvulsants and get started on what can we do naturally to help manage seizures. Herbal anticonvulsants include valerian, skullcap, passion flower, bacopa, and kava, each with varying degrees of GABAergic and neuroprotective and sedative activity to help modulate seizure thresholds. Now, if you don't know what a GABAergic agent is, let's just click on that and find out. Again, this is the color for healing agents, generally herbal. They work by modifying the brain's main inhibitory neurotransmitter, GABA, through receptor activation, ion channel regulation. Remember, seizures are channelopathies, problems with ion channels, and also neurotransmitter metabolism. Here are the core mechanisms. We have two main types of GABA receptors, GABA A and GABA B. They act differently. Some herbs act on GABA A receptors, other on GABA B. And this is all about the synthesis and release. Here are the functional outcomes of agents that act on GABA. There's reduced neural excitability. Neurons are less likely to fire. so it's calming things down. There's a balance of excitation and inhibition, so it prevents excessive neural activity, protecting against seizures, anxiety, and excitotoxicity. The clinical effects are sedation, reducing anxiety and some anticonvulsant activity, muscle relaxation, anesthesia, and all of this depends on what agent you're using and the receptor subtype. So here's a summary. Let's go down to herbal GABAergic agents. The top ones include valerian, passion flower, lemon balm, lavender, magnolia bark, green tea, and in green tea it's the L-theanine component of green tea that's acting on our GABA receptors. Also California poppy. All these herbs are known to modulate GABA receptors or increase GABA levels, producing calming, anxiolytic, or sleep-promoting effects. Here are the key GABAergic agents. Again, you can click on those to go to them and learn more about them, how to use them. Valerian, passion flower, lemon balm, lavender, magnolia, green tea, California poppy. This is a comparative matrix. We see what is the active compound. In valerian, for example, it's valerianic acid, and it acts on GABA A receptor, modulating it. The main effects are sleep aid and reduction of anxiety. Why these agents matter? They're often chosen as safer, gentler alternatives to pharmaceutical GABAergic drugs, like benzodiazepines. While they're not as potent, they can be effective for mild anxiety, stress, and sleep disturbances, and many are used in traditional medicine systems worldwide. Now here's a seasonal rotation chart. We like to rotate the herbs and supplements that we're using so the body doesn't get too used to them, and our bodies change through the seasons, so some work better in the winter, some work better in the spring. Let's see, we're going into winter, so at the time of this recording, so magnolia bark would be a good one, and that's the Hoopa magnolia. Lavender, here we see how green tea could be used to calm focus in shorter daylight. And here's some notes on rotation. Valerian is best in the winter and autumn when deeper sleep is needed. Passion flower shines in the spring and summer for calming restlessness. Okay, so I think you get the idea about that. Let's go back to our herbal anticonvulsants. And here we've got a chart that explains what their mechanism is and some notes about their use. And they're all linked, so you can click on skullcap, go there and learn about it. So skullcap is GABAergic. It's neuroprotective due to its flavonoids. It's often paired with passion flower or lemon balm. Alright, so here's some cautionary notes. Interactions. Herbs like St. John's wort, ginkgo, and garlic can interfere with anti-seizure medications and should be avoided if you're using those. There is a sedation risk with valerian, kava, and passion flower, especially when combined with central nervous system depressants. Most herbal anticonvulsants lack large-scale clinical trials, so you want to be working with an herbalist or a naturopath. And then we've got some mechanistic insights. Many herbs act through this GABAergic pathway system, reducing neuronal excitability. Others offer antioxidant and anti-inflammatory effects that can lower seizure susceptibility. And some herbs modulate serotonin, acetylcholine, or glutamate, contributing to broader neurochemical balance. Now this is an herbal anticonvulsant matrix to just fill you in a little bit more on what can be done. Now you see here, the end is cut off. Now you can change that by taking your mouse. A blue line is appearing. I'm going to click on my left mouse, drag it over. You'll find some additional information here about how these things are working. On valerian, for example, we see in regards to the neurotransmitter targets, it's going to increase GABA and decrease glutamate. As far as the seizure type relevance, tonic-clonic seizures and stress-triggered seizures. And there's also emotional profile listed here. Deep sedation, fear to sleep. In terms of the design note, GABA-dominant herbs are best for acute anxiety-linked seizures. Cognitive modulators like Bacopa and Centella, which is Gardacola, support memory, neuroplasticity, and post-inflammatory recovery. Emotional archetypes are taken into consideration because they can guide pairing. Passion flower for relational fear, Bacopa for fear of forgetting, mugwort for fear of the unknown. There's also a system of logs that you can copy to track the improvement or occurrence of seizures. This is a neurological emotional shift log, so you could copy this down and you just track it on a daily basis. On a weekly basis, you could track a weekly mechanistic feedback matrix. Same thing for monthly pattern mapping. Another one for sensory ritual feedback. And we close this section off with various articles and studies on these components. If we look back over on the left-hand side, again, all of these underneath the title Herbal Anticonvulsants have some kind of an effect on reducing convulsions. There's a scroll bar, which means they're not all visible, so if we scroll, we can see all of these that have been shown to have an effect on reducing convulsions. Going back to seizures now, we can pick up where we left off with this layered comparative chart comparing the supplement SAMe, PEA, and our herbal GABAergic agents in seizure pathways. These are the mechanistic entry points across inflammation, oxidative stress, and receptor modulation. So we can compare them. We can also take a look at secondary pathways and network effects, evidence level and typical use positioning. And here we have integration points with conventional anti-seizure strategies. Safety and practical consideration, living with seizures, and then of course we've got all kinds of articles and studies on causes and risk factors, prevention and treatment, and so on and so forth. So let's talk about epilepsy, because when there are seizures, often it's epilepsy that comes first to mind. So what's the difference between having a seizure and having epilepsy? Let's start with this caution. There's a risk of non-epileptic seizures being misdiagnosed as epilepsy, and patients treated with epilepsy medications for quite some time before the correct diagnosis is made. The drugs don't work on non-epileptic seizures. A seizure is a single episode of abnormal electrical activity in the brain, while epilepsy is a chronic neurological disorder characterized by having 2 or more unprovoked seizures at least 24 hours apart. So let's break it down. We've been through seizures. It's a sudden burst of abnormal electrical activity in the brain. We've already seen some of the symptoms. Even déjà vu is considered a symptom of a seizure. We have the different types. We've already seen how they can be caused. They last 30 seconds to 2 minutes, and seizures longer than 5 minutes are a medical emergency. But when it comes to epilepsy, it's a chronic brain disorder where a person experiences recurrent, unprovoked seizures due to abnormal electrical signaling. Diagnosis: it requires at least 2 seizures without a clear trigger like a fever or injury occurring more than 24 hours apart. The causes we've already seen. We can have causes from genetics, developmental brain abnormalities, head trauma, infection, stroke, or tumors. But in about half of the cases, the cause is unknown. About 3.4 million people in the U.S. live with epilepsy. They're often treated with anti-seizure medications. Some cases require surgery or brain stimulation. Up to 70% of people can control seizures with medication. Think of it like this. Having one seizure doesn't mean you have epilepsy. Tuning into epilepsy here, we've got a lot of videos. And we've got the symptoms, the different types of seizures, diagnosis, treatment. Options can involve vagus nerve stimulation, ketogenic diet. But as you'll see, we've learned that a Mediterranean diet can be even better in living with epilepsy. Here are articles and studies, the risk factors, various treatments. Okay, so let's skip over to the left-hand side and take a look at processed foods' effects on epilepsy. Most people with epilepsy experience negative effects from eating processed foods. Here's a chart that's showing you high glycemic index food where their blood sugar swings can contribute because they're loaded with refined carbs, sugars, high fructose corn syrup, that causes rapid spikes and crashes in blood glucose. The strength of evidence here is very strong. Glucose excursions can lower seizure threshold, especially in temporal lobe epilepsy. Many patients report more seizures after sugary junk food days. There are pro-inflammatory effects. High in omega-6 seed oils, trans fats, emulsifiers, advanced glycation end products causes systemic and brain inflammation. There's strong evidence for this. Chronic low-grade inflammation worsens epilepsy. Higher inflammatory markers correlate with poorer seizure control. Then processed foods can also contain excitotoxic additives like MSG, aspartame, artificial sweeteners, carrageenan, certain preservatives. Evidence here is moderate, mostly anecdotal. A subset of patients are clearly sensitive and get seizures hours after consuming these. And then we get micronutrient depletion. Magnesium, zinc, B6, vitamin E, and omega-3s are anticonvulsive nutrients. If patients are not getting enough of those and they're deficient, that can lead to convulsions, and the evidence is very strong. They're proven pro-convulsant. Many on long-term anti-seizure medications are already deficient. Then, of course, the gut microbiome disruption. In processed foods, we find emulsifiers, artificial sweeteners. The lack of fiber leads to dysbiosis and reduced short-chain fatty acid production. There's growing evidence about that. Altered gut bacteria leads to increased gut permeability, in other words, leaky gut, and that leads to neuroinflammation and a lower seizure threshold. Some patients improve dramatically when they cut out the ultra-processed foods and restore microbiome diversity. And another factor is oxidative stress. Fried, reheated seed oils, acrylamide in chips and fries, high sugar equals free radical damage to neurons, and there's solid evidence for that. Oxidative stress is a known mechanism in the genesis of seizure-induced brain injury. Bottom line recommendations for someone with epilepsy: minimize or eliminate the classic ultra-processed foods like sugary drinks, packaged snacks, instant noodles, industrial bread and pastries, chicken nuggets, most breakfast cereals, processed meats with additives, etc. Prioritize whole or minimally processed foods, vegetables, fruits, nuts, seeds, eggs, fish, olive oil, avocados, meat without additives, which is not that easy to find these days. Many patients see measurable improvement, fewer seizures, ability to lower medication doses within weeks to months of cutting out ultra-processed foods, especially when combined with a Mediterranean or modified ketogenic low glycemic index diet. Of course, the effect size is going to vary. Some people notice almost no change, but a large subgroup, probably 30 to 50%, report significantly better control. Let's see what else we can find about epilepsy. Here are agents that treat epilepsy. A lot of them are the same as the anticonvulsants we looked at earlier. Deep brain stimulation, responsive neurostimulation, VNS and DBS for epilepsy. What's that? Vagus nerve stimulation, VNS, how it works, its benefits, and then deep brain stimulation, that's DBS, how that works and its benefits. Mediterranean diet and epilepsy. This is one of the best studied and most effective non-pharmacological interventions for epilepsy in adults and children. Multiple high-quality studies, including randomized controlled trials, now show clear benefits, especially in drug-resistant epilepsy. Here's a summary of the proven benefits, why it works for epilepsy, practical epilepsy optimized Mediterranean diet, what the best responders actually eat, comparison with the classic ketogenic diet, see what else we can look at. There's a connection with autism. What about epilepsy in pregnancy? Epilepsy intellectual disability in females, epileptic emergencies, mental health in epilepsy, sudden unexpected death in epilepsy, the various types of epilepsy. Let's click on that one. So we've got autoimmune epilepsy, adult onset, chronic, Dravet syndrome, drug-resistant focal epilepsy. I'll leave it to you to click on any of those that interest you. I think for now, in closing, there are a couple of other things I want to show you. First of all, on the side, this neurocysticercosis. This is a parasitic infection that can cause epilepsy. Just something when they're trying to diagnose a cause behind it, consider that this could be a possibility. It's a parasitic infection of the central nervous system caused by the larval stage of the pork tapeworm. And then we also want to take a look at anti-epileptics, and also those are the pharmaceutical drugs. And we're going to go up here to anticonvulsants, anti-seizure drugs, and then we're going to go to interactions with anticonvulsant drugs. Just in case somebody is using these, you need to be aware of interactions with those drugs. So here are herbs and supplements that can have an interaction. Borage and evening primrose oil shouldn't be used with them because they can lower the seizure threshold. Folate and folic acid can increase seizures in individuals with epilepsy and may interfere with phenytoin therapy. Ginkgo can decrease the anticonvulsant effect of a drug, so don't use it at the same time. Ginseng may provide an additive anticonvulsant action that's theoretical. Glutamine, theoretically high doses, can overwhelm anticonvulsant drugs and pose a risk to individuals with seizure disorders because many of them work by blocking glutamine stimulation in the brain. Hawthorn can increase the sedative effects of CNS depressants like barbiturates, so avoid using at the same time. Kava taken with barbiturates can result in increased sedation. Lemon balm can increase the sedative effects of barbiturates and CNS depressants. Magnesium can interfere with the absorption of phenytoin, which is used as a drug. To avoid this problem, magnesium should be taken at least 2 hours before or after these drugs. Sage can decrease the action of anticonvulsants, so avoid concurrent use, and that's just theoretical. Baikal skullcap can increase sedation of CNS depressants. Avoid using at the same time. Valerian can increase the effects of CNS depressants. Avoid during concurrent use. Niacin can increase serum levels of anticonvulsant medications, possibly requiring a reduction in the drug dose. So here we see a number of the anticonvulsant drugs, but we're not going to go into that right now. I think I've shown you enough about seizures and epilepsy for you to explore in here and come up with some answers from whatever seizure disorder you're interested in learning more about, how it's caused, and how to stop it.